present this to the legislature? I think they need to hear it and see it.
You know, I'm embarrassed to say I had not thought of that, but I should. Thank you. Yes. Yeah.
Well, I just, I agree with everything you say, but at this point, I'm wondering, if we make our kids healthy and don't educate them, what favor are we doing?
Yeah. And actually, let me say, obviously, I do tell people at some point, there's so many things I could tell you about healthcare, but one thing you should know about healthcare is that there's a thing, this concept called, determinants of life, social determinants of health. And so if you look at what determines the health of the population, only 10% is medical care. Only 10%. 40% is behavioral. Whether you're obese, whether you smoke, whether you're physically active, and then a little bit less of drinking, drugs and stuff, because not that many people do those things. About 30% is genetic. You have no choice. It's just what you were dealt. And then another 10 or 15% is environmental, and social, economic, another 10 or 15% in there. I don't remember the numbers exactly. But every one of those factors other than genetic, the wealthier you are, the less they affect you. And so wealth is a great unifier. And if you look at what determines wealth, education. So when people say, what can I do to save healthcare dollars? It's be sure that every child gets a college education and a good job. And so I completely agree with you that if you look at it on a macroeconomic level, for sure, education would trump healthcare if you look, the health of the population. And we need to focus on that as well. And that's why I don't feel too guilty that one of my big bills this year will be to make sure that vouchers are illegal, because we cannot have our public education undermined.
What type of legal entity is this school?
Oh, I haven't gotten there.
What type of legal entity is it? Is it
It would be non-governmental.
So it's private?
It would be, yeah. Well, yeah, it's private. Yeah, it's private, non-profit, owner, operator. It's cooperative.
Okay, but it would be state-sponsored?
No, state would have nothing to do with it. And so actually I got an email from a woman who said she was actually upset because in Colorado now insurers have to provide maternity care. And she said, why does my family have to pay for that? And when she said my family, I thought that must mean you have children. I wonder who paid for your maternity care, but that's a different story. And I told her about my idea about the cooperative, and she said, if it's not governmental, why are you a senator? And I said, that's a good question. So the reason I'm a senator is because when I was just a doctor, nobody listened to me. It's true. But and I'm in the Senate, and I am playing as nicely as I can with everybody because I want to be head of Health and Human Services, because I think my voice will be heard better in that position. So it doesn't have to be in the government, but I think to make this kind of dramatic change, you need to have a podium to speak from, and this is my podium.
I of course, I love the presentation. That was an excellent presentation. I'm often in the private sector though, and talking to people in the private sector, and people will tell you, well, all the innovation with the drug companies is because of all the money going in. So if people feel they could get rich off of this, they're going to run in and race, and they're going to look for the next cure for whatever kind of cancer, just like they came up with the recent, cure for the other kind of cancer. Well, anyway, so I think Barry Keene had some arguments about that, like NIH or something.
No, yeah. So a lot of the funding for basic science research comes from the federal government through the NIH and is done at the universities. What happens is that we don't fund the universities well enough to take that out to the patient clinical trial portion. And then if you actually look at how many new drugs come out versus pharmaceutical company A say new drugs versus how many times they just repackage or revamp an old idea, it's far less new drugs than revamping and repackaging. But I guess, one of the mistakes that I've been told, and I think is true, is that too often, people with high educational degrees try to reason with people with evidence and knowledge, and that doesn't work. And so I guess what I would say instead is, well, then how come France gets the drugs cheaper than we do? Why can't we get the price that France gets and not even go there? You know what I mean? So the argument going with them is that we want to not have to pay more than these other countries, especially if we're paying for the research.